An allogeneic bone marrow transplant doesn't happen without a donor. To recognize National Bone Marrow Awareness Month, we hope you can join the National Bone Marrow Transplant link for our November Lunch and Learn, featuring donor Reagan Bell. She'll share her incredible story and explain how you can get involved. Join us November 20th at noon Eastern. To register, visit nbmtlink.org or follow the link in our show notes. Welcome to Marrow Masters Season 15, sponsored by Kite, a Gilead company, and Bristol Myers Squibb. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow and stem cell transplant, from diagnosis through survivorship. Season 15 of our show focuses on CAR T-Cellular therapy. This innovative and life-saving treatment is gaining momentum and has become a first-line course of treatment in recent years. We will dig in, learning more from clinicians, survivors, a caregiver, a nurse, and a psychologist. This season will offer education, insight, hope, and so much more. Here's your host, Executive Director of the NBMT Link, Peggy Burkhardt.
Hello, everyone. So today we welcome Terena of Tampa, Florida. Terena is going to share her CAR T experience, the challenges, the tests, the fears, the hospital stay, remission, and then life post-CAR T. We're going to dig in on what it's like, how she is today, and the many changes Terena now makes to stay healthy and toxin-free. Oh, Terena, thank you so much for being with us today.
Thank you, Peggy and John, for all the work that you're doing at helping cancer patients. I'd also like to give a special thank you to the National Bone Marrow Transplant Link for this educational podcast on CAR T. I'm blessed to be a part of helping others that are thinking about or undergoing CAR T.
Terrific. So, Terena, we're going to jump right in. We're going to talk about your diagnosis and just get started here.
I was diagnosed with mantle cell lymphoma, stage 4, blastoid. I had a Ki-67 score of 10 to 20% with the gene alteration TP53, and I was diagnosed September of 2019.
Did you have any symptoms before your diagnosis?
I started with hot flashes when I was 42, and then the night sweats came shortly afterwards, and they would be pretty profuse. I would tell my physicians when I came to the appointments, but especially the GYN physician, and they just said that, you're going through menopause. This is normal. I told them that, this has been going on more than 5 years as I was 47, and they assured me that this was just menopause and that some people could go through it. Maybe not everyone, but I was still in that range of menopausal. So I went on hormones at 57, and they immediately went away within 1 week. And it was wonderful because I'd been suffering from hot flashes and night sweats for 15 years. And then 2 years later, I got diagnosed with mantle cell lymphoma from a bone marrow biopsy, and I was 59 then. And I had also noticed a drop in my platelet count. It wasn't by much, but when you looked at them at a serial levels, you could see the drop, but the doctors didn't see any significance in that.
Okay. Wow, that's a long time to suffer with hot flashes. I can't even imagine that. So let's talk about the blood tests and all the treatment that you underwent.
I see a mantle cell specialist, and there's 2 tests that the mantle cell specialists do that a regular oncologist might not be aware of. And one of them is a FoundationOne Heme. It's a genetic blood test, and it identifies specific genes that you carry. And I carry the alteration in the TP53. And getting this test, the doctor was able to look at my genes and determine which therapy would be best for me. The other test that I get done is called clonoSEQ. It also is a genetic test. It can be done on blood or your bone marrow, and it measures the amount of cancer that you have or what cancer they're testing. So for me, it's mantle cell. It's not going to pick up a secondary cancer that someone may have, but it measures the cancer. And the doctor can really look at that and see the numbers decreasing or increasing, and it lets them know that your therapy is working.
Okay.
So initially when I was diagnosed, I was put on a therapy called R-squared, and it's Revlimid and rituximab. And I continued this treatment until December of 2020 when I got CAR T. And I got Tecartus is what the mantle cell patients get. The other name for that is brexocabogen, and it targets the anti-CD19. And I got that December 9th, 2020.
Okay. So what tests were done in advance for your CAR T?
They had a lot of screening tests and baseline level tests that they did. I had to have a behavioral health exam, which I had never had before. Echo, EKG, ABGs, pulmonary function test. I had to get a CT of the head. I met with the dietitian, social worker several times, the chaplain. I was assigned a CAR T nurse, and I had to get a letter from the dentist saying that my teeth were fine. And I had to get a history and physical from my medical doctor. And there was a 3-hour apheresis to get your T cells, and then they send them away to get manufactured. And 3% of patients that get this done may not manufacture. But right now, you can get them donated. So that's kind of like plan B if it doesn't work for you.
Okay.
There is hope that you can still get CAR T. Because when I was getting it, if they didn't manufacture, you didn't get CAR T.
I did not know that. Thank you.
Yeah. And there was a 2-hour teaching session for you and your caregiver. And I had to get a tunneled IV central catheter. Now, from talking with some patients that have CAR T recently, they allow them to get a PICC line, which is a much less invasive procedure. And I was fortunate. I was up to date on my mammograms and colonoscopy because they would have wanted that also.
Okay. Wow. So we're going to talk about next the reactions and side effects of CAR T, because we hear a lot about this, and you are firsthand going to share what this was like.
They can be severe and they can be scary. And the doctor was very good about informed consent. And what I mean by that is telling you at every visit about these side effects. So each person reacts differently, and you really need to control your stress and don't worry about the side effects, because you'll be in the hospital and they will treat you. Now, for me, I had a cytokinin release syndrome, grade 2, and I did get the tocilizumab, and I had an elevation of cardiac and liver enzymes, and they sent me immediately for an echo, and they ordered a cardiac consult.
Okay.
I also was running fevers, 102.5, and I was already seeing the infectious disease doctor, but she came in that day and I went down for a chest x-ray, which pneumonia for us is a high risk, and I was okay with that.
Good.
I did have mild arthritis to my shoulder, my knee, and my neck, and the pain just really settled into these areas, and I had never hurt that bad. So I was not expecting that. So hopefully that doesn't happen to anybody else. But they did show up. I thought it was interesting. They do a PET scan in a month, Peggy, and these areas showed up on the PET scan. It was the first time it was ever mentioned. It was over 2.5.
Huh. Okay.
So I also had hypotension and dizziness and a neurotoxicity of grade 1, where they give you steroids and then they have you write a sentence daily. The tremors that I had were very evident. And when I was writing that, I knew I was in trouble. You could not even read it. So I did get better in a couple days, but I was really feeling it. That was like at my peak of my worst.
Okay.
And then they also have you count backwards from 100 just to make sure that you're processing things in your brain. And they want you to identify items. So the doctors all come in with stethoscopes around their neck. So they're saying, what's this? Holding up items. And they just want to make sure that you're able to identify these.
Okay. How'd you do with that?
Well, I did fine with that. One time I wasn't able to count backwards from 100. I made it down to like 40. And I was really having trouble getting it out. Because I had a new abdominal mass that it came up just prior to CAR T. They were giving me radiation, and that made me so nauseous that I wasn't able to eat. So the weakness of not eating and the low blood pressure that was caused from the CAR T just was really getting to me. So I was told that I would lose 8 to 10 pounds, and I actually lost 20.
Wow.
They wouldn't let me up without help because of the blood pressure. They do what they call orthostatic blood pressures, which is basically blood pressure sitting and then standing. And if you drop more on the top number by 10 points, they don't let you up for that day.
Okay.
Now, for me, my hemoglobin went down to 6, and I had to get 2 units of blood. But I was told that was from the radiation, and they give you a 3-day chemo before you go. And I was told it was from that. It was not from the CAR T. So those were like the biggest reactions that I had. But I did not have any seizures. I did not have any reactivation of the shingles, the Epstein-Barr, the cytomegalovirus, the herpes simplex virus. And they do put you on a shingles prevention, acyclovir, and a pneumonia prevention, avitoquin suspension antibiotic for a year.
Wow. Do you think they learned this along the way with other patients before you that was needed?
Yes. It's my understanding twice a year, all the mantle cell doctors get together, and it's internationally attended from like fall and spring. And they all get together and they compare notes and they talk about their patients, their outcomes, and what one institution is doing compared to somebody else. And they really are paving the way for CAR T.
Wow. Talk about a team huddle. That's great. How wonderful they could get together and just help future patients just by sharing these cases.
Yeah, the physicians are very dedicated, and especially at cancer facilities, because they really do want to help, our cancer population. And they're doing that, especially with these new treatments. And CAR T is supposed to be, the up and coming new thing.
Absolutely. So Terena, let's talk about your length of hospitalization.
I was in the hospital for 15 days, but I had my CAR T back in December of 2020. They are narrowing that length of stay down. And I read an article last week on CAR T where there's actually sending people home. Mm-hmm. And then when you come back for your daily visit, if you run into a problem, then they admit you. So for me, I was in the hospital for 15 days. Then I got discharged, had outpatient daily treatment for a week. Then I came in every other day for a week, and then 3 times a week, and then once a month. And they would do IVs and labs.
Okay. I was talking to a center the other day that said this exact thing, that they are now, it's an outpatient basis, and they believe patients are doing better because they're home. Plus probably costs less then too, I would imagine, for the patient. So infection, we hear this all the time regarding CAR T. Can you share your story about infection?
Yes. I was told the highest risk of dying from infection was at 3 months after CAR T, and it was from pneumonia. And I was also told, because I was in during the COVID era, that if I got COVID, he did not know what would happen to me.
Oh, my goodness. On top of everything else, you had that unknown to deal with. Did you ever get COVID?
I did, but not during then. I got it November of 2022. So it was about 2 years after CAR T. Okay. And I did go in and get the Paxlovid.
Okay.
And that helped.
Yeah. So what was the follow-up like and your path to remission?
They do a PET scan in a month, and I was not in remission.
Okay.
And that was kind of hard to swallow because you go through all this and you're not in remission. But they did a PET scan in 3 months, and I did get my remission in 3 months. And then they do it every 3 months for a year, and then every 6 months for 2 years, and then annually. And I also get that clonoSEQ testing done when I get a PET scan done. But my clonoSEQ testing, because I'm on the PET scan annually plan, the clonoSEQ testing is done every 6 months. And if that becomes abnormal, then he will do a PET scan. But Medicare covers PET scans differently, and they do more CAT scans routinely, but they do cover clonoSEQ testing where some insurance companies do not cover that.
Good to know. Thank you. Well, I'm glad you hit it at 3 months. I'm guessing that's probably about the norm for most CAR T patients.
Yeah, I'm not sure. I've talked to several patients about CAR T, and the few patients that has had the CAR T, they got their remission in 1 month.
So, Terena, when did you start to feel normal, feel better?
When I came home, I wasn't eating well those last 8 days in the hospital because the nausea and vomiting was so bad. So I started feeling better about 2 weeks, and I started eating, and then better in 3 months and closer to normal in 4 to 6 months. And I gained my weight back slowly, but it took about 4 months.
Well, that's good. Okay. Wow. So something we don't usually talk about, but it's so important, the cost of CAR T. How did your insurance handle it? Do you mind sharing that with us?
Sure. The total hospital bill, but not counting the pre-testing, was $1,046,000. The insurance paid $442,000, and they gave me an itemized bill. The itemized bill, the pharmacy was the largest of that 1 million plus bill, and it was $959,000. And we paid $1,515. But some of this did include that outpatient clinic visit.
That is unbelievable. Wow. It's encouraging to know that so much of it is covered. I will say that. So, Terena, how did CAR T affect your hair?
I was told my hair would thin out in 2 weeks, but I would still keep most of my hair. So in 3 weeks, I lost about 90% of my hair in 2 days. I was not prepared for that. And it was just so sparse that I just cut it all off. And it did start growing back, and it did grow back straight for about 5 months. And then it just went into a super curly mode. And I had gone in to see the doctor, and he told me this was going to be my new normal. And this was like the first time I heard of it. And I was like surprised. When you look in the mirror, I just didn't recognize myself.
Sure.
Gray hair can get more coarse as you age, but it's very similar to the texture when I was young. And it did straighten back out. I had maybe a little bit more body than I had, but I'm happy with it, you know.
Yeah, and body's a good thing. We'll take it, right?
Yeah.
Okay. So, Terena, what changes did you make to your diet after your CAR T procedure? I know this is important to you and also to me.
Yeah, I did juice for about 6 months prior to CAR T. I just made juices in the morning and would drink 6 to 8 cups in a day, in addition to eating. I made celery juice is very good. Carrot juice was my favorite, but I would blend beets and the beet greens. I wasn't real fond of green juice.
I can relate to that.
Yeah. If you Google it, they'll tell you how to do it. They want the air out. So you put them in the little tiny mason jars, and then they want you to drink it within about 3 or 4 minutes once you open it. So you have to be ready to drink it. It's hard to drink for me, a green drink that fast. I started seeing an integrative medical doctor in 2014, but she was also trained as a family medicine doctor. So she had me do a lot of things back in 2014 that I still maintain today. And I followed an anti-inflammatory diet. I try to eat more organic. And there's an annual list called the Dirty Dozen and Clean 15 that comes out every year, and you can Google it. The dirty foods are heavy in pesticides, so you want to eat those organic. And the clean foods, you can eat them conventionally grown. I also do no GMO food. Gluten, soy, corn, and sugar beets are big. And there's other ones too. I eat minimal dairy, and cheese is my thing. But I try to eat organic, no antibiotics, no hormones when I do eat cheese. And the same thing with meat. I try to eat the organic, grass-fed, no hormones meat. Processed foods don't always agree with everybody, and we don't realize it. So I really limit my processed foods and no MSG, artificial sweeteners, sugar. Most of our sugar today is from sugar beets and not the cane sugar that we had as children. So those I don't eat. I try to eat my fruits and vegetables, either fresh or frozen, meaning I avoid canned. Coffee, from my understanding, is heavily sprayed. So I try to drink the organic coffee, and teas are good. Green teas are great. And I make my own ginger and turmeric tea. And I actually really enjoy these teas a lot. And you can Google that to see how that is made. And then I sprout broccoli sprouts from seed. And those taste like radishes. And you can eat them on salads or just eat them plain. I also eat a lot of cruciferous vegetables. Chia seeds are great, and you can make a chia pudding. And nuts and pumpkin seeds are good, and other seeds as well. I eat organic berries probably every day, sometimes twice a day, avocados. And there's a lot of benefits to apple cider vinegar. I do not drink it personally, but I do put it in like salad dressings and marinades and sauces. And then I try to hydrate on lemon or lime water. And I also use a lot of organic bone broth.
Well, that is a great list. So thank you so much for sharing that. So when you and I spoke, I really got the feeling that you have simplified your life. You have found so many wonderful ways to remove the toxins that harm all of us, you and your loved ones. Can you share some of the great changes you have made in regards to this?
Yes, Peggy, I'd be happy to. I changed all my cleaning products and I use more natural things, and you can get them in the regular stores now. Personal care products, a lot of the stuff that we use are not good for our health. So I do not use nail polish, hair dyes, perfumes, and I really check my things that I'm putting on my skin, like shampoos, conditioners, lotion, sunscreen, makeup, toothpaste, soap, laundry soap. And there are food and cosmetic apps that can help you decipher what's good versus bad on food and personal care items. All you have to do is scan the barcodes, and it'll tell you why they think this product is bad, and they'll give you alternative suggestions.
So, Terena, can you send me a list of some of these apps, and I will include it in the show notes?
I'll be happy to. I also use an air filter in the house, and I filter the water that I drink and cook with. Plus, I have a house filter. Now, my integrative doctor started me on an infrared sauna. I really enjoy that a lot. And I use a red light therapy and a vibration plate. And the vibration plate helps move your lymphatic around. With lymphomas, we have problem with our lymph being stagnant. So Epsom salt and apple cider bath soaks are great. And it's really important for us to move. And I try to mix it up with yoga, cardio yoga, regular exercises, where I'm just doing squats, lunges, push-ups. We walk with weight. And I have a neighbor friend of mine that I need accountability to have somebody to do stuff with. And she's kind of like my personal trainer. And if I wasn't feeling well, she would tailor what we were doing that day. The integrative doctor does have me on supplements, but all supplements need to be okay with your oncologist. And he was okay with the ones I was on. And I do cook in glass or stainless steel, and I avoid styrofoam and plastics. And I personally don't use the microwave.
Very good. So as we kind of wrap things up here, Terena, any other best practices, suggestions to share with other people?
I'm Christian, so I had a lot of people praying for me, having meals pre-made and frozen, especially those first few outpatient clinic days. They were 6 to 8 hours. To come home and have to pick the meal would have been just totally fatiguing for me.
Mm-hmm.
I also make a lot of homemade breads for breakfast, and having those ingredients, the dry ingredients pre-made. So all you had to do is just add egg and milk was very helpful. I did prepay all my bills ahead and any other work around the house that needed to be done that could be done ahead to get me so I didn't have to do this being so fatigued. A big thing for me was accepting help from others. I'm usually the helper.
Mm-hmm.
You're not allowed to drive for 2 months because of the seizure risk.
Okay.
So it was during COVID, so I couldn't get Ubers. So I needed to rely on others to drive me around.
Well, and let's face it, we weren't really going many places either, right?
No, but, my husband went back to work after those first 2 weeks. So now I have to start asking my friends. And some friends live close and some friends live far away. So it's kind of hard to have them drive a half an hour to take you to an appointment and back. So my husband and my family, I had a couple close friends, were just great support people. And they were just there for me whenever I needed them.
Oh, great.
Because of infection risks, they don't want you outside, like walking to the mailbox without a mask.
Huh.
Remember I said pneumonia was the biggest thing? It was even up to 3 months later was the highest risk of death. So you had to wear a mask around. And I'm a gardener. I like to cut my grass. I have banana and other fruit trees all around the yard. And they did not want you in the soil because the soil has organisms, bacteria, and fungus, and that can set up in your lungs. So just try to keep moving, even if it's small walks in the house, if you don't feel well, because you just got to move. We were made to be moved.
Uh-huh.
And I also listened to a lot of health webinars and from the Leukemia and Lymphoma Society webinars and podcasts.
Yeah, they have fantastic programs. I want to ask one more question about the gardening. Was there a time frame on that? Or are you allowed to garden now? Was that just for a while?
He didn't say. I gave up cutting my grass for 2 years.
Okay.
Each time you go back to the appointment, he keeps saying you're not out of the woods. And he still tells me that now. I mean, I've been in remission for 3.5 years, but there's no guarantee that this is a cure. RT is still new, and people with the TP53 gene don't do as well as those that don't have the TP53 gene alteration.
And you have that?
Yes.
Okay. So you're on high alert still. I'm sure that could be another whole episode talking about what that feels like. But I have to say, Terena, just listening to you and getting to know you a little bit, you are such an inspiration. And you're sharing just so many details here that are personal. And you're going to help so many people by sharing your heart and your experience. So I really thank you for this today.
Well, thank you, Peggy and John. I'd also like to thank the National Bone Marrow Transplant Link for the opportunity to share my CAR-T experience today. I've been blessed through this treatment, and I pray that it can help others through their cancer treatment as well. And it was a blessing to speak with you today.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.